As we look here, this is a full model of the lungs. You have your thyroid cartilage, the cricoid cartilage, our thyroid gland, hyoid bone. As we come down, our trachea shows how it leads down into the lungs. This is our right lung. We have the superior, middle, and inferior lobes. And on the right lung, we have this superior and inferior lobes on the left side. If we look at the lungs, you can see the different vessels. This is our bronchioles running through here. These are our pulmonary arteries and veins showing that way. On this side, you can actually see those vessels. This is our pulmonary trunk running from the heart. This is the pulmonary artery running into our lungs, carrying the deoxygenated blood. This is the pulmonary vein running back to the heart, carrying the oxygenated blood. And then you can see the branches of all the pulmonary tree, or the bronchial tree inside there. If we lift out the heart, we can see that trachea running down here. We can see the three branches going off into the three lobes there, the two branches going into the two lobes here. Where the bronchial trunk and the pulmonary trunks enter into the lungs, remember that is called the hilus, the hilum plural. This is our esophagus running down here. This is actually the thoracic aorta running back here. That'll be on your blood vessel test next month. If we look at our heart, small model of our heart, we have our right atrium with the right auricle. This is the left ventricle, or right ventricle, the left ventricle, and then the left atrium up here with the auricle sitting on top. Once again, this is the pulmonary artery. This is our aorta. This is the superior vena cava and the inferior vena cava, draining blood back to the heart. Here you can see the pulmonary veins, two branches going back into the heart. If we open up the heart and we look at our chambers, this once again is the right atrium, the superior vena cava, inferior vena cava, both emptying into this right atrium. Our tricuspid valve, blood will travel through the tricuspid valve into the right ventricle. These are our chordae tendineae, papillary muscles. They are supposed to be attached to. Back here you can see it attached to that papillary muscle. You can see the ventricular septum here. The atrial septum is a little bit more difficult to identify. The fossa ovale, probably more about right this area here. We have our pulmonary trunk, or pulmonary valve, our semilunar valve leading up into that pulmonary artery, pumping the blood to our heart, our lungs. As our pulmonary veins enter back into the heart, you can see they enter into the left atrium. You can actually see the little passageways where they are coming into the left atrium. This is our bicuspid valve, or mitral valve, leading to the left ventricle. The blood pumps out of the left ventricle through the aortic valve, or the semilunar valve here, leading out into the aorta. The aorta immediately branches as the blood comes out into our coronary arteries, our passageway of our coronary arteries. The right coronary artery comes along the right side and feeds the right side of the heart.